Every American, no matter what phone you have, no matter where you are, will be able to call just 3 numbers, 988, if you or a loved one is having a mental health crisis. And you're going to get to talk to someone immediately. The one big skeleton was that I suffered from post-traumatic stress when I came back from Iraq. But I made this decision to share my story, and I thought it might end my political career. Instead, it's really launched me on a mental health crusade. Even when people need help, too often they're afraid to get it. You're talking to a trained crisis counselor, someone who's had a lot of experience talking to people when they're at their most desperate moments and talking them back, helping them get through that moment so that they can get long-term help and connecting them with resources to get that help wherever they are. It's completely confidential. They're not going to send police to your door. They're not going to tell your parents or your loved ones. They're not going to put your name in a database. So many young Americans are struggling because of the pandemic. It's really highlighted the mental health crisis that frankly already existed in America. I want people to know that this isn't going to be perfect. You know, when we established 911 many years ago, not every call got routed to the precise, correct fire station on day one. So just understand that we're going to get this up and running, and it's going to start saving lives the minute it goes live. But we still have some work to do to perfect it, to make sure that not a single person gets lost in the system. So when I decided to share my own story of dealing with post-traumatic stress, I released a 3-part mental health plan. The first part, establishing this 3-digit national hotline. The second part, expanding care for our military service members and veterans. And then the third part is extending that model to every high schooler in America. I want mental health checkups to be as routine as getting your annual physical, something that you just do to check up on yourself, even if you don't think you're sick. That's going to take more funding and more time. But I'm working on it because I know it will make a difference in millions of lives.